Medical Monday is brought to you by East Cooper Medical Center.
Well, welcome back to Living Local. Today I am joined by Dr. Raya Kaplan. How are you doing?
Good, thank you. Thanks for having me.
Absolutely. So we're going to talk about something that's a little bit difficult today. You are a gastroenterologist here at East Cooper. Now, we're talking about colon cancer.
Yes.
And what people need to do to make sure that they are getting screened and staying healthy.
Correct. Yep. Yes, so colon cancer is actually quite prevalent. It's actually the third most common cancer, excluding skin cancers. And it's also the third most common cause of cancer deaths amongst men and women. So it's actually quite common. Most people either know somebody, family friend, heard of somebody who's had colon cancer. So it's certainly something that's out there. People don't like to talk about it necessarily, but it's definitely prevalent. And there are screening tests, which we'll talk about, that can help prevent it.
Now, what are some of the things that people need to know in terms of why they should get screened?
Right.
Is it symptoms or is it family history, a little bit of both?
Okay. So colon cancer, let's start off by kind of explaining what colon cancer is, where it comes from. So there are certain things in the colon called colon polyps. Some colon polyps are the precancerous kind. They're called adenomatous polyps. Some of them are hyperplastic polyps that don't turn into colon cancer. But the ones that we are concerned about, obviously, are the precancerous adenomatous ones. Most of the time, people don't have symptoms when they have colon polyps. So that's why screening is so important, to follow the guidelines, which now have changed to 45 for starting average risk screening colonoscopy. So in folks with no family history of colon cancers, no symptoms, starting age is now 45, used to be 50. And it's so important to do that because you may have polyps, which are the precancerous kind, that we want to remove before you get colon cancer. Or you could have a small cancer and have no symptoms, so we could potentially find it earlier where it's more easily treatable.
All right, let's talk about screening then. We normally think colonoscopies, icky, hate them, you know? But there's other ways you can also screen for colon cancer.
Correct. So the gold standard is colonoscopy, which is the dreaded test that nobody wants to have done. I promise it's not as bad as it seems. The day before for the colonoscopy, there's a colon prep, but the preps now have gotten better. Other options include Cologuard, which is a stool test. So your doctor orders the Cologuard test, you get the little kit in the mail, put a stool sample in it, send it back. The company looks at the stool, and essentially they're looking for DNA from colon polyps and colon cancers, and there's also a component that just looks for blood that's in your stool.
Okay.
And so if that comes back positive, it could be because you have polyps, cancer, or just blood in your stool from, say, hemorrhoids. Or it could be false positive. Regardless, if you have a positive Cologuard, you need a colonoscopy diagnostic to figure out why.
Gotcha.
So still, I would say gold standard is colonoscopy. Cologuard is only for patients with no family history, no prior polyps, so only appropriate for patients who are considered average risk for screening can get Cologuard. If you have symptoms concerning, not appropriate for Cologuard. So I'd say colonoscopy first. Cologuard is better than nothing. Either way, get your colon checked out.
All right, so what are the next steps for someone watching who might want to come and get screened?
So if you would like to get screened for colon cancer, several options. One is to first talk to your primary care doctor. They may be able to make a referral for you. Some primary care doctors can order a Cologuard as well, if appropriate. And then obviously seeing your local gastroenterologist. Some offices require referrals. My particular office, you can just call and make an appointment yourself. You don't have to have a referral. So several different options, but number one thing is just do it.